today we have Anne, and Anne is part of our 40-something cohort. Beautiful lady. I just want to tell you what we've been doing. So already we have done the right side of Anne's face. And what have we done? We have done what we call a lateral vector lift and a chin jawline enhancement. And what is that? So if you take a look at this side of Anne's face, this is the side I haven't done. You can see that the cheek is a little dropped and the nasolabial groove is actually quite demarcated because the cheek has dropped and moved inward. This is essentially the reason this is created and all this drop is because this used to sit like this. And so what we've done on this side of the face, you can see, is we've enhanced the contour and we've actually gone into the deep fat pads of the face and the bones to actually create this lifted effect. So this side is finished, this side is not. Lateral vector lift. What is involved in lateral vector lift? Essentially 3 interventions. A temple injection to lift the brow, a cheekbone injection. It's a retraction injection where I pull back the muscle and actually inject right onto the bone 3 small amounts of product. And then right on top of the masseter muscle, but below the actual cheekbone, I will actually inject additional filler product in this upward direction. And what that does, the sum of those 3 will do this. Then what we do, if we need to, is we clean up further. And cleaning up further usually is this area, which is basically the medial cheek. The medial drop in the cheek causes a tear trough formation and this groove to form. So what I like to do is come in with a cannula from about here and fill this area anywhere between half a cc to 1 cc of product. And then at the same time, the rest of the cleanup would be softening up of the nasolabial folds further to give us basically what we have here. So that's the lateral vector lift foundational intervention. 4 syringes. Lower face. What happens in the lower face? We're in the upper face, we have the cheek dropping and moving inward. In the lower face, the structure between here and here in the chin area collapses, bringing the chin up and creating these mellomental lines and this sense of sag laterally. So what we want to do here, and this side has already been done, although you can still, we just did the procedure, but you can see a definite difference between here and here. What the first part of the intervention is my coming in laterally and filling this first area we call C1. And that will drop the chin down a bit. After I do, usually what I do here is about 0.7 cc's, and then I'll angle the cannula and go into the tip of the chin with the remaining 0.3 cc's. So that's essentially what you see that has been done here. And then I come in to this area, which is actually just inside the marionette lines, and I will go in with a cannula underneath here, and I will fill this triangular area with about half a syringe. Following that, I then go into the jawline. And I come in with the cannula from out here, and I run the cannula all the way to the tip of the chin below this area that I previously filled, and I just fill along here. About 0.3, about half, almost half the syringe goes into the tip area, and the remainder goes along the jawline. Another 4 cc's. So we're talking between lateral vector 4 cc's, lower chin jawline enhancement 4 cc's, and then clean up with another half. This is a 10 cc intervention, but the results are amazing and last quite long.
so good. I can't believe what I'm seeing in the mirror, and everything's just, I feel much younger and feel like I'm ready to start this year. Real good. Thank you.